that is a groundbreaking milestone for our Kenyan health sector, especially with regard to the management of cancer. Over the last 8 years, we have steered our country, Kenya, closer to a new reality where every person has access to quality, affordable health care. And today, we add yet another arrow in our quiver in the fight for universal health coverage, a priority for my administration as one of the pillars of our Big Four agenda. The scourge of cancer, as we all know, has bedeviled our nation for decades. The financial burden of cancer has added to the physical and emotional burden of this disease, forcing many families to seek diagnostic and treatment services outside of Kenya. This integrated molecular imaging center is the first, as we have heard, of its kind in a public hospital in Kenya, but also the first of its kind in the Eastern African region. This facility is part of the Kenyatta University Referral Hospital Comprehensive Cancer Care Center, and it contains world-class equipment that will help transform our national and regional response to the unyielding threat of cancer. We as a country and as a government are making these investments in recognition of the fact that cancer today is the third leading cause of death in Kenya, and projections show that the burden of this disease will grow by approximately 85% by the year 2030 unless we as a government take bold steps to address the challenges related to this disease. Key amongst cancer challenges is early diagnosis and accurate stage grouping, that is to say, stage 1, stage 2, 3, or 4. And with this local facility, patients will no longer have to travel abroad to get accurate cancer diagnosis and quality cancer care. I wish to assure all Kenyans that the doctors, the specialists we have here, the equipment and services are now at par or better than those found in the countries that historically Kenyans were traveling to for diagnosis and treatment. Today we have heard that there are already patients who have undergone diagnosis here at the Integrated Molecular Imaging Center. And I'm glad to note the impact of this intervention in their livelihood. So today we know that outward medical tourism, especially for cancer care, results in Kenyans spending approximately 10 billion shillings every year abroad on early and accurate diagnosis and subsequent quality treatment. Additionally, and of great concern to me, is the fact that not every Kenyan citizen can afford to seek services in hospitals outside Kenya, meaning that those with cancer often have late diagnosis and treatment. When cancer diagnosis is delayed or inaccessible, there is not only a chance of survival, but also increased complications in treatment, leading to increased cost of care. So early diagnosis, as we have heard, is therefore an integral part of improving cancer care management. As a government, we have invested a lot in health, equipping health facilities, training healthcare workers such as nurses and doctors, as well as other healthcare professionals. In addition, we have also invested in the construction of additional public health facilities and also undertaken the reform of the National Health Insurance Fund. All these efforts are to ensure that Kenyans access quality and affordable health care here at home. Ladies and gentlemen, the government has launched several initiatives specifically addressing cancer care. In July of 2020, we launched the new cancer control strategy, and additionally, the Ministry of Health has also proposed a nationwide lifestyle modification campaign. To fortify this intervention, we also rolled out the Breast Health Awareness Campaign, which aims to improve access to breast cancer care in our country. In Kenya, breast cancer is the most diagnosed cancer and has annual incidences of 6,000 new cases and 2,500 related deaths every year. In response to this and working closely with county governments, we have also established 10 fully functional county-level chemotherapy centers, ensuring that treatment is available in several counties, and these include, amongst others, Mombasa, Kisumu, Kakamega, Garissa, Nyeri, Nakuru, and Meru. We have also developed and disseminated the National Cancer Screening Guidelines to all counties, and we continue to encourage screening and provide annual cervical cancer screening services. And we urge all eligible women to take advantage of the healthcare facilities, which include maternity and nursing homes, Level 4 facilities, such as the sub-county hospitals, county referral hospitals, and Level 6 facilities. My administration continues to make remarkable progress in addressing affordability of healthcare services through, as I said, the repurposing of NHIF. Under this framework, NHIF will cover diagnostic tests at the Integrated Molecular Imaging Center here at KU Hospital. And as I said earlier, these are the tests that Kenyans seek when they travel out of the country. And in fact, the National Hospital Insurance Fund has a series of comprehensive oncology packages that will eliminate the need to travel outside Kenya for cancer care. As an example, as we heard earlier, 6,451 cancer patients benefited from the NHIF oncology package in the financial year 2019-2020. So today I once again urge all Kenyans to secure their health care by registering with NHIF. This medical cover will increase access to healthcare services at affordable rates. The NHIF cover already caters for cancer treatment, including radiotherapy, chemotherapy, brachytherapy, which is an internal radiotherapy treatment that specifically targets tumors in the body, which is also now available here at this referral hospital. So today, ladies and gentlemen, we are not only officially opening the Integrated Molecular Imaging Center, but also the Integrated Molecular Imaging Center Hospitality and Accommodation Center, having the support as we all know, of one's loved ones is also key in the success in conquering cancer. This hospitality and accommodation center will ensure that families can stay close to their loved ones receiving treatment here, while also providing accommodation for outpatients from far afield as they await subsequent rounds of treatment, eliminating the need for long back and forth journeys that levy a heavy toll on their health and also their recovery. So I want to conclude, ladies and gentlemen, by commending all those who have worked diligently over the past 1 year to make this day a reality. I take the opportunity to thank the hospital's board of directors, the hospital management, all the contractors, the equipment suppliers, GE, and all of them, and all members of staff for their tireless efforts. And I also laud the KU Referral Hospital for the immense contribution to our administration's commitment to the transformation of our health delivery systems. This contribution is a pointer to the level of excellence that we should expect from all our public hospitals across the country. As I close, let me say that as a country, we will keep our focus on the reduction of cancer cases, while at the same time enhancing survivorship rates. I therefore look forward to seeing the continued growth of Kenyatta University Teaching, Referral, and Research Hospital. We have agreed that we will be here in January for the cyber knife. Good. As well as other healthcare institutions across our country, and we urge them all to continue meeting our objective of ensuring that Kenyans have the best possible healthcare at the most affordable price. With these few remarks, it is now my distinct honor and privilege to declare the Integrated Molecular Imaging Center and the Integrated Molecular Imaging Center Hospitality and Accommodation Center officially opened. Mungu awabariki. Mungu aendelee kuibariki nchi ya Kenya.